Hello, in this short film, we're going to look at the Nobel Prize in Physiology or Medicine from 1909, awarded to Emil Theodor Kocher for his work on the physiology, pathology, and surgery of the thyroid gland. Here you have the thyroid gland. As you can see, it's in the neck. It's butterfly shaped, as you can see. And this is how a model of it. You see there are three lobes, one in the center, the pyramidal lobe, and the right lobe and the left lobe. Then from the original Nobel Prize site, some more on his work. The thyroid gland is a gland in the neck that is destroyed by goiters, which can lead to difficulty in breathing in serious cases. This led to attempts to remove the gland by surgery. However, this was risky and could result in serious health problems. In 1883, Theodor Kocher shed light on the thyroid gland function in metabolism, among other things, and he showed how surgery could be carried out safely through good hygiene and minimal blood loss. He also showed that a viable part of the gland needs to be left intact during the operation. As you can see, this is coming from the original website. If you want to go there, type in this link. There's some biographical information also from the Nobel Prize site summarized by me. Later Koch was one of the first to go over to pure abscesses. This means that he didn't do operation unless there was absolutely nothing left from any sort of microorganism. And he learned through his collaboration with Tevel, whose bacterial studies on the effective he sought to advance. Koch's worked experimentally on gunshot wounds, and with shearing he produced the most extensive research. These investigations led to numerous small contributions and two larger works on gunshot wounds from 1880 and the theory of gunshot wounds due to projectiles of small caliber from 1895. Among Kocher's other most important work were those on acute osteomyelitis from 1878 and the theory of strangulated hernia from 1877. They may be. He published his method for the radical operation for hernia. A large work was on hernia in infancy in Gerhard's handbook. Apart from hernias, the surgery of the abdominal organs in resurrection of the stomach, he received a new procedure, pyrolemectomy with subsequent gastroduodenostology, that means operation on the larynx and subsequent making the connection between the stomach and the duodenum. An excision of the rectum, preparatory excision of the coccyx was introduced, that means removal of the tailbone, which had been initiated by Kraska. Other works were on the radical cure of cancer, the surgical treatment of gastric complaints in 1910, and in eternal choledochoduodenostomy, that's about the duodenum, he established the procedure for the excision of gallstones. In mobilization of the duodenum, he greatly advanced all operations affected the duodenum. With Dr. Matti, he wrote 100 operations on the bile ducts. This improved earlier surgical treatment of gallstones and simplified them. Other larger works dealt with the ileus and the diseases of the male sexual organs, injuries of the vertebral column, and fractures. In our knowledge of traumatic epilepsies and on some conditions for the operative cure of epilepsy and paper injuries and concussion of the brain and trepanning, he devised a new treatment for pes virus, that is operation on the foot, a work on the phosphorus necrosis, that is the jaw, and another on coxphara, that's on the hip. Well, this is summarized by me. If you want to read complete biographical information, you have to follow this link. Here you see a goat affected by goitry. We saw that. This means that the thyroid gland doesn't work. Then the award ceremony speech by Professor Count K.H. Murner. I hope I say that correctly. The thyroid gland, thyroidia, is one of the structures in the organism whose significance has only been clear during the last few decades. At the close of the 1870s, the function of this gland was a complete mystery. It was even questioned that it had an actual physiological significance for the organism, at least. On the other hand, it was a common experience that it could be the site of pathological changes. Yet it was hardly right that this gland should have been undervalued, not to say this day for so long. Ashley Cooper had already observed disturbances in animals after removal of the thyroid. These were specified with greater precision by G.M. Schiff in Bern. He found that animals in which the thyroid had been extirpated often died in circumstances which suggested that this gland might be of great importance to the organism. Unfortunately, these observations did not receive necessary attention and development. It's only after similar results had been obtained with human beings that the question of the thyroid's significance was analyzed successfully. Observations made by surgeons were the cause of this. The disturbances which occur with a pathological enlargement of the thyroid are often so grave that people had already for many years been extirpating the thyroid occasionally to relieve them, despite the difficulty in which the operation then presented. Indeed, in the days before the introduction of antisepsis, it often happened that the patients died of the immediate results of the operation. After the introduction of antisepsis, a significant improvement took place in this respect. As a result, the number of operations of this kind in which the whole gland was removed increased considerably. In the meantime, it was gradually noticed that the procedure was by no means satisfactory, even if the operation and subsequent healing had gone well. Not infrequently, after a period of apparent health, significantly disturbances in the general health made their appearance. The conscientious investigations of the cases of illness resulted in the establishment of a new song called Cachexia stumpifera, which was that's cretinism, disturbed growth, which was characterized by muscular weakness, swelling of the extremities and the face, anemia, forgetfulness, decline in intelligence, and finally death from exhaustion. Once attention had been drawn to this conclusion, enthusiastic and productive research into the significance of the thyroid followed in many different centers. In this, reliance was placed on observations on human as well as on animal experiments. From this research, an understanding of the physiology of the thyroid had evolved, which is comprehensive, even if not complete in all respects. We know that this gland is a vital organ, whose total removal in experimental animals invariably causes death within the course of a few days or weeks. The gland of great importance in the general nutrition of the adult and especially in individuals still undergoing development. The loss of the thyroid function results in serious disturbances in its nutrition. Metabolism is significantly diminished, growth ceases, the skin and the subcutaneous tissues that's under are the site of mucus infiltration, degenerate processes or internal organs, serious disturbances make their appearance in the functions of the nervous system and muscles. It became clear that gland acts by elaborating a secretion which reaches the various parts of the body. It is, as the expression goes, an internal secretion. Later it became evident that such processes of internal secretion are of exceptionally great importance. Not only the thyroid, but also various other glands, such as the adrenals and the pancreas, play a characteristic part in the processes within the organism by elaborating a secretion peculiar to each gland, which is not excreted, but is diffused throughout the organism and is of greatest importance to it. The knowledge of the physiology of the thyroid has brought a valuable increase in our understanding within the field of pathology. Through it, new light has been thrown on hetero mysterious Nobel conditions. Pathological changes in gland can lead to suppression or decrease of its function. Various morbid conditions are explained by this, among which are cretinism, disturbed growth, and myxodemia. Is a slime get under the skin. On the other hand, one looks for the explanation of various other disturbances as those in morbus basidoi, in abnormally increased or in possibly qualitative abnormal activity of this gland. This briefly outlined important and momentous development which has benefited medicine during the past 25 years was brought into being, as I mentioned before, as a result of observation which has been made by surgeons. In this respect, the first public utterance was made in September 1882 by Professor J.L. Revedin in Genova. At this time, his colleague in Bern, Professor Kocher, had also turned his attention to the same subject, and in April 1883, the latter gave a comprehensive exposition which had been of fundamental importance to the later development of thyroid surgery, as well as to important areas of knowledge of this gland. Through Kocher's exposition, it became clear that complete extirpation of the thyroid is reprehensible. A portion of the gland which is capable of functioning must be left behind at operation. This very important principle of surgical intervention has always been observed from that time onwards. With regards to the surgery of the thyroid, Kocher has subsequently continued to occupy a leading position. It should be possible to omit on this occasion a report concerning the development of the method of operation and the suitability of the various types of intervention in the cases. But now it should suffice to recall that there are now several thousand people who owe their regained lasting health directly to him after a goiter operation which he has successfully performed. A far greater number, which cannot be estimated, owes him a debt of gratitude indirectly for similar results. Fatal cases or secondary illnesses have become more and more of a rare in goiter operations. However, it is not only the treatment of the goiter which has been the subject of Kocher research on the goiter. He has also carried out an extensive investigation into the causes of the occurrence of goiter in certain regions and into the cretinism connected with disturbances in the thyroid function. In the thyroid, as already indicated, other diseases can occur in addition to those which arise with the ordinary goiter. To these as well, Kocher has devoted successful work. Okay, this is a summary of the award ceremony speech. If you want to read the complete speech, you can follow the link. Links will also be provided to the site, Nobel site, in the description of the video. Here you see, by the way, some cells taken from the thyroid. You see that there are at least 3 different types of cells present there. And here you see the thyroid and it's working. It is triggered by hormones coming from the hypothalamus, especially TH and subsequently SH, which work on the thyroid gland, which in its turn produces the hormones T3 and T4, which diffuse through the whole body and influence it. You can also see that there is a negative feedback from the thyroid gland towards the hypothalamus. Okay, that was it for the moment. Next week we will go into the prize again with the lecture, Nobel Prize lecture, given by Kocher. For now, thank you for watching and maybe till another time.